Hello and welcome. Today we're diving into a fascinating and sometimes misunderstood condition that affects hearing auditory neuropathy spectrum disorder, or ANSD. While it might sound complex, we'll break it down to understand what it is, how it impacts people, and what can be done about it. So, what causes auditory neuropathy spectrum disorder? The truth is, the exact cause can vary. In many cases, it's linked to genetic factors, meaning it can be inherited from parents. Premature birth, low birth weight, and certain complications during pregnancy or delivery can also increase the risk. Additionally, conditions like jaundice or infections, especially in early infancy, have been associated with the development of ANSD, and in some cases, the cause remains unknown, highlighting the complexity of this disorder. To understand ANSD, it's helpful to know how hearing normally works. Sound waves enter the ear are converted into electrical signals by the inner ear's hair cells, and these signals then travel along the auditory nerve to the brain. In ANSD, the inner ear itself, specifically those hair cells, may be functioning correctly. However, the issue lies in how the auditory nerve transmits those signals. The signals may be distorted, inconsistent, or even blocked, preventing the brain from accurately processing the sounds. It's like having a good microphone, but a faulty cable connecting it to the speaker. While precise global statistics are difficult to obtain, auditory neuropathy spectrum disorder is estimated to affect a small percentage of newborns with hearing loss. It's believed to account for around 10% of cases of sensorineural hearing loss. Because of challenges in consistent diagnosis across populations, the actual number may be even higher. Awareness and improved diagnostic methods are helping to refine these figures over time. The signs and symptoms of ANSD can be variable. Some individuals with ANSD might have normal hearing, while others experience mild to profound hearing loss. A common characteristic is difficulty understanding speech, especially in noisy environments. Someone with ANSD might hear that sound is present, but struggle to distinguish individual words or sounds clearly. They may also experience inconsistent hearing, where sounds seem to come and go in clarity. Tinnitus, or ringing in the ears, can also be a symptom. Diagnosing ANSD typically involves a combination of audiological tests. A key test is the otoacoustic emissions, or OA, test, which measures the function of the outer hair cells in the inner ear. In ANSD, OAs are often present, indicating the hair cells are working. However, the auditory brainstem response, or ABR test, which assesses the electrical activity in the auditory nerve and brainstem, shows abnormal or absent responses. This discrepancy between normal OAs and abnormal ABR results is a hallmark of ANSD. Additional behavioral hearing tests help determine the extent and nature of the hearing loss. While ANSD isn't typically broken down into distinct types in the same way as some other disorders, it is often classified based on the location and nature of the underlying issue. Some cases involve problems with the inner hair cells, while others relate to the auditory nerve itself or the connections between the two. Understanding the specific part of the auditory pathway affected can sometimes influence treatment approaches. Currently, there's no cure for ANSD, but there are several strategies to manage the condition and improve communication. Hearing aids can be helpful for some individuals, amplifying sounds to make them more audible. Cochlear implants, which bypass the damaged auditory nerve and directly stimulate the brain, can be a successful option for those with more severe hearing loss. Speech therapy and auditory training can help individuals develop strategies to better understand and process sounds. And of course, communication strategies like visual cues and sign language can also play an important role. Because the causes of ANSD are often complex and multifactorial, prevention is challenging. Genetic counseling may be helpful for families with a history of hearing loss. Careful monitoring and management of pregnancies, especially those at high risk, can also reduce the likelihood of certain complications that can contribute to ANSD. Prompt treatment of infections in infants and avoiding exposure to excessive noise are also important preventative measures. The prognosis for individuals with ANSD can vary greatly. Some may experience significant improvement with hearing aids or cochlear implants. The key is early diagnosis and intervention. Ongoing research is focusing on developing new therapies and a better understanding of the underlying causes of ANSD. Gene therapy and other cutting-edge approaches hold promise for the future. In the meantime, continued advancements in hearing technology and rehabilitation strategies are helping individuals with ANSD lead fulfilling and communicative lives.